Welcome back to another episode of the Doctors and Dollars podcast. I'm your host, Nate Crannell, joined today by Dr. Payel Gupta. Dr. Gupta is a seasoned physician with over a decade of clinical expertise. As the co-founder and chief medical officer of Cleared, a telehealth platform dedicated to allergic diseases, she orchestrated its acquisition by LifeMD.com in January 2022. Now as the medical director of allergy, asthma, immunology, and ENT for LifeMD, she continues to revolutionize healthcare. Dr. Gupta is also the proud owner of Ease Allergy in Brooklyn, New York, and has served as the president of the New York Allergy and Asthma Society. A podcast co-host, volunteer spokesperson, and a global health advocate, she's making a significant impact in the medical world. Welcome to the show, Dr. Gupta.
Thank you so much for having me, Nate.
What's going well today?
It's a beautiful day. Got to take my son to school, and that's always fun and just a highlight of my day.
Hey, to say it's a beautiful day, because you're in New York, so a beautiful day in late January is always a good thing to say. Doesn't happen often. That's awesome. Well, I want to start early in your career. What drew you to allergy and immunology, as your fellowship, after doing your residency in internal medicine and pediatrics?
Yeah, so I personally suffer from a lot of allergic conditions. I have
Mhm.
allergies in my eyes and nose. I have asthma. I have eczema. My mom also suffered from asthma. And so I grew up just kind of dealing with asthma and allergies. And so it just kind of felt like a natural fit. It was also wonderful because most allergists treat both adults and kids. And I did do internal medicine and pediatrics as my base training. So I really do enjoy treating the full spectrum of patients. So it just felt like the right fit for me.
Absolutely. Is there, as you mentioned, the different people in your life that have similar things? Talk about the genetics behind that. Is that something that, hey, I suffer from eczema and my mom does and my grandma did. Is that genetic or is it environmental?
It is. There is a genetic predisposition to allergic
Okay.
conditions. So if you have a parent that has allergies, you're more likely to have allergies. And so, yeah, it does run in families, unfortunately. But you can
Yeah.
get allergies and no one in your family has allergies. So there is that too. And as our environment's changing, we're seeing more and more people that develop allergies that don't have a family history of allergies.
Gotcha. Is there more? I know there's a lot of common allergies that many people have, but is there more allergies that are prevalent to be passed down genetically? If you can talk about just hey, this type of allergy that a lot of people have is genetic and it's the most common that gets passed down genetically.
So it's really just so we call it being an atopic person. And so
Okay.
within the atopic person, which means allergic, there's conditions like asthma, eczema, allergies of the eyes and nose, food allergies. So all of those things are atopic conditions. And
Hmm.
it doesn't mean that, for example, with food allergies, people will be really nervous that, I have a shellfish allergy, so I don't want to give my child shellfish because I'm nervous that they're going to also have a shellfish allergy. So we don't see that particular thing where it's like, if you have one particular food allergen, that your child will have that exact same
Hmm.
food allergen. It's just that predisposition to being atopic and potentially having any one of those allergic conditions if your parent has one of those conditions.
Gotcha. So ones that may be more genetic based are skin related. Is that fair?
Really, any of them. So,
Okay.
any of those atopic conditions, you could have any or all of them, or none of them if your parent has one or any or all of them. So, I'll just give my example. I have, as I mentioned, allergies of my eyes and nose, asthma, and eczema. And I can tell that my son, he's only 3, but it looks like he does have environmental allergies. He was just diagnosed with asthma. So, he's starting down what we call the atopic march, which means you develop one condition and then you start developing more atopic conditions. Again, every person is different, and it doesn't mean that he's going to have every single one of my allergies exactly the way that I do, but he is just more likely to have allergies because I have them.
Gotcha. And we'll talk about Ease Allergy, your business in Brooklyn here in a bit. But is that one of the main things that you're working on at Ease? Is there a way to stop that march? The march that your son you've noticed has started to take. Is there a way to stop that, or is it just how can we diminish or treat it in the appropriate way?
Yeah, so there is some data on if a child, for example, is what we call monosensitized, so if they have one allergy, like a dust mite allergy or grass allergy, and you treat that allergy with immunotherapy, which is a form of treatment that makes that person less allergic to what they're allergic to. It's not a cure, but it does make them less allergic. That potentially, if that patient does not have asthma yet, you could prevent them from developing asthma. So there is some data on that early treatment or desensitization could prevent other atopic conditions from showing up. But again, yeah, so that's one of those kind of conditions.
Yeah. So one question I was wanting to ask you as soon as we scheduled this. So my son has weak lungs. He was in the NICU as a baby. Anytime that he gets, the common cold, gets the cough, gets the congestion, it just seems way worse than my other kids. I have three kids. It's just way worse than my other two. And so we have a nebulizer at home that we put things through, and that seems to help once it's already happened. Is there similar treatment like that? Is it something that where if we like nebulized once every other day, as we get into cold and flu season, would that help prevent? Or is a device like a nebulizer more reactive?
Yeah, so great questions. So essentially, when somebody has airways that respond to treatments like albuterol, which is a medication that we use through the nebulizer. So I'm assuming that
Mm-hmm.
that's the medication that you're putting into
Mm-hmm.
your son's treatment into the
Yep.
nebulizer. So when someone's responding to albuterol and that helps open up their airways, that's essentially defined as asthma. Okay,
Mm-hmm.
that's how we make the diagnosis of asthma. And in particular, as a child gets older, then we're able to do something called pulmonary function testing or spirometry, where we can see that they get they take the albuterol, we do the test to see how well their airways are functioning. Then we give them a treatment with the albuterol through the nebulizer or through an inhaler, and we see then after that treatment what does their lung function look like, and specifically
Hmm.
something called an FEV1, which is a particular value on the spirometry, should go up by 12%. And that's like the
Okay.
full definition of, yes, this person definitely has asthma. But when children are younger, they're not able to do spirometry testing because it really is effort dependent and they have to understand the instructions on how to do it. And so we don't get the right values if we do it when they're too young. And so just responding to albuterol is essentially a definition of asthma. If
Interesting.
their airways open up and get better, that's kind of a hallmark of asthma. And so for your son in particular, he is triggered, it sounds like, by viral infections. And that's a common
Mm-hmm.
trigger for most asthmatics. There's lots of different triggers. There's allergic asthma, there's cold induced asthma, there's exercise induced asthma. You can have one of those or you can have all of those. Like, so I always give myself again as an example. I have exercise induced asthma. I sometimes have cold induced asthma, and then definitely, especially this viral season, I've gotten sick several times, and every single time my asthma is acting up a little bit. And what I mean by that is I'm having symptoms of asthma, whereas normally I don't have symptoms of asthma.
Mm-hmm.
So when a child in particular is having symptoms of asthma, every single time they're getting sick, and they're getting sick more often, and their symptoms are kind of progressively getting worse with each cold, then sometimes we do put a different type of medication in the nebulizer, which we call a preventative treatment, and that is an inhaled steroid. So
Okay.
steroids reduce the inflammation in the airway. Albuterol helps open up the muscles and relaxes the muscles. So those are the two components of asthma. One is inflammation, and the second is that the muscles around the airways tighten up more easily. And so the albuterol works on that part, and then the steroids work on the inflammation. And then there's other medications for patients with more severe asthma called biologics that also work on inflammation. And there's other inhalers like Spiriva and things like that. So there's lots of different ways to improve the inflammation and open up the airways and with different medications. So we really have to look at the history that the person is presenting with. And if it seems like they're really having a lot of exacerbations and needing the albuterol pretty often, then we know that there is a little bit of inflammation in their airways that we want to help them out with. And we want to put them on something like that, maybe even just during viral winter season. And that'll
Hmm.
just improve their overall tolerance to getting sick, and their airways won't get so irritated every single time that they're sick.
Yeah, that was great insight. Thank you so much for sharing that. Just from a personal perspective, that's really helpful. How young is too? You'd said like sometimes they're too young to really do that testing. How young is too young?
It really depends on the child. So some children
Okay.
can follow instructions super early, but it really just depends on the child and where they're at and their
Okay.
ability to follow instruction. And really, sometimes we just try to do the spirometry to try to start getting them used to doing that lung function test. The values don't really help us in deciding which way we're going to go. Really, for a lot of medical conditions, history is key. So knowing, every doctor gets really good at this over time, but knowing what questions to ask and how to ask them in order to get the right clinical information, that is almost like 99% of what we do on a daily basis. And that's why I'm such a big kind of advocate for telemedicine, because I
Hmm.
think that we can get so much information and help so many patients through their medical history, and just asking the right questions. And sometimes the exam and testing isn't as necessary, but obviously it depends on the condition and what we're treating and all of those things.
Absolutely. That's awesome. Triple board certified. You're pretty darn smart, Dr. Gupta. Let's just leave it at that. Triple board certified is pretty impressive. Allergy and immunology, internal medicine, and pediatrics.
Mhm.
So, question is, so like our kids, we're not supposed to pick favorites, but which one of those three is your favorite from a passion standpoint?
Sure. So, I mean, we do our base training in either internal medicine or pediatrics. I
Hmm.
chose to do mine in medicine and pediatrics, which is called MedPeds. And that's a 4-year training kind of protocol versus 3-year training for each of them. So you kind of get all of that education squashed into 4 years as opposed to 3 years each. And the reason that I chose to do that is, again, I love treating all age groups and wanted to be able to see all age groups, but I also wanted to be able to specialize. And so, family medicine doctors can see all age groups. But then when you do a family medicine residency, you're limited to certain areas that you can subspecialize in. Whereas if you do
Yep.
med peds, you really are open to doing any fellowship that you want. And so that's kind of how I went into it. And then allergy immunology is like my specialization. So that's really
Mhm.
where that's where I thrive, and I love it just because I'm able to see so many different conditions. And that's part of why I picked allergy immunology also, is because you're really treating the skin, the lungs, the eyes, the nose, the immune system, the airways. So really we see, and even the GI tract, because there's conditions like eosinophilic esophagitis. So there are so many different areas of the body that we treat and see. So every day I'm seeing different types of patients and treating different conditions. Whereas when you subspecialize in like pulmonary medicine, which is just the airways, you're mostly focused on the airways. And that's cool too.
Mhm.
But for me, I'm kind of like, I like to do lots of things, as you can tell by my resume. And so I
Yep.
just like having that diversity in my day.
Yep. I've said this about another guest before, but I'm going to say it for you. You're like a Swiss Army knife, right? You can you can do a lot of different things, and
Yeah,
and
that's
you've
a good
designed it that
analogy.
way, in the right way. So it sounds like allergy and immunology, because that was your fellowship, because it's where you, it feels like that's where you get most of your passion from. What is your favorite then from an impact standpoint?
Oh yeah, same thing. I mean, so
Same.
basically, yeah. I mean, as far as like internal medicine, pediatrics, I'm still treating conditions that internists and pediatricians treat, but just specifically certain conditions focused on the allergy immunology space. But within the allergy immunology space, I really love treating asthma patients. Uh, I mean, I love all the conditions, but asthma, I think you can make a big impact because when you can't breathe, you really can't do anything. And so for those patients that come in that are having a really hard time breathing, I just love being able to help them breathe better.
The Physicians Financial Summit is coming to Chicago in 2024. Now, the Physicians Financial Summit is probably exactly the opposite of what you think it is. I'm sure you've gotten a free dinner and went to an event where a financial advisor shared a few things and tips and tricks. That's not what this is. You're not going to get a free dinner, unfortunately, and we are not financial advisors. This is going to be an action-packed 2 days where we break down the exact playbook that I used that allowed me to retire at the age of 33 and is going to guarantee that you are prepared and ready for a prosperous retirement. Now, there's way too much info that I can cover in this video, but I will promise you 2 things. 1, this is going to change your life forever. And 2, we are going to make this much simpler than you realize was possible. Just like you break down important and complicated medical stuff for us as patients, we're going to do the same for you. So, if talking about money would make you want to pull your hair out, this is not the event for you. But if you want to see behind the scenes of how the wealthy prepare their financial futures and what you can do to be better prepared financially, then we will see you there in March 2024, Chicago.
For sure. And let's not breeze over the fact that you just mentioned some condition that ends with ophagitis that you breezed right through that word. No
Yeah.
problem.
So eosinophilic esophagitis is just essentially it's inflammation of the esophagus. So it's the tube, obviously, that leads or it leads from your
Mhm.
mouth into your stomach, the esophagus, and there's certain cells called eosinophils that can cause inflammation, and they can be over. They're just basically there's too many of them in the esophagus, and then they start causing inflammation in certain people. And so that's called eosinophilic esophagitis specifically. So
Nice.
it's eosinophil is a cell, the esophagus is where it's affected, and then itis, anything that ends in an itis means inflammation. So eosinophilic
Inflammation.
esophagitis. Mhm.
Appreciate you breaking that down for me. I didn't know that's how it was all
Yeah,
put together. There's a lot of times where you'll see a medicine on a commercial, where this couple is in bathtubs on a beach or something like that, trying to distract you from it while they're reading off all the side effects.
yeah,
But I always notice like the nice commercial name of the medicine, and then below it they'll say like the whatever you want to call that, the other word or the more scientific term for it. And man, I
yeah,
can never pronounce those. So I
yeah.
appreciate you breaking that down for me.
Medications is totally random. Also, the naming,
Yeah,
but the naming of conditions sometimes makes a little bit more sense. But the
it
medication
does.
names are just literally, it's like naming your kid. You can literally name it anything you want, and that's kind of what they do. Yeah,
Whatever markets the best, right?
yeah, exactly.
Let's talk about a big venture that you had, Cleared. So you put together Cleared, like I mentioned in the bio. It's a telehealth platform dedicated to allergic diseases, which was then acquired by lifemd.com in 2022. So talk to me about the genesis and the growth of Cleared, which was during the pandemic, and then why was the timing right to be acquired?
Yeah, so I mean, honestly, I was really lucky. I met 2 individuals that wanted to start something in the allergy immunology space, and they were really the co founders. And then they brought me into the mix because so they both have allergies, asthma, things like that. Ryan and Jimmy, they were kind of my partners in crime. And I got put into this entire situation in 2019. They asked me to kind of consult with them a little bit. So I was very loosely consulting. And then in 2020, they asked me to be one of the co founders. And then the pandemic hit, and it was really the perfect time for telemedicine, which is
Mhm.
what the space that we were getting involved in. And we worked really hard. And it was, I'm going to tell my son this one day when he understands what I'm saying, but it was really because he was in my belly. I was pregnant
Mhm.
during the pandemic, and every decision I was making was basically centered around him, and I wanted to keep him safe. And working in a normal clinic setting did not feel like it was going to be safe. So I really just went headfirst into this venture and stayed at home, kind of took a leave of absence from work because I was just nervous about being in a clinic setting in April of
Mhm.
2020 during the pandemic. And then one thing led to another, and we really were able to develop this idea and put out something that actually was working. We were able to see thousands of patients over telemedicine and specifically asynchronous consults. So there's two different types of telemedicine. There's synchronous and
Okay.
asynchronous telemedicine as two different categories. And asynchronous basically means that you're not on a video consult with the patient. You are getting information, clinical information about them that they've provided. And then the doctor is able to, the provider, I should say, is able to look at that information at a different time and evaluate it and then send feedback or recommendations to the patient. So that's what an asynchronous consult is. Whereas what most people think about telemedicine is what we're doing right now, kind of on a video consult, and we're able to talk in real time, so that's synchronously, and discuss what's going on and then make recommendations, which is, more closely resembles a normal consult that you would have in an office. So we
Okay.
did more of asynchronous medicine, and essentially it was a lot of work, a lot of work, but the timing, everything really worked out. And I wouldn't say, I know in my bio you said that I was, one of the main people that helped that acquisition. I definitely helped create the company, definitely helped put everything together, but I would say Jimmy and Ryan were, obviously the people that put through that acquisition and made it happen. And it was just the perfect timing for us because we were a very small team working super hard. And right when we signed the deal was right around the time that everyone was like, oh, all the health tech money has dried up. The industry's looking not so great. And we were all just like, oh God, wow, phew,
God, I've got through it.
like we
Yep.
literally just got in by the skin of our teeth. So, and the acquisition by LifeMD is a great company. They're doing some really, really cool stuff. And yeah, it was a great team and I enjoy working for them still. We're not doing as much allergy immunology as we were in the beginning, but that's a part of acquisition, right? So a company that buys you is going to go in the direction that makes sense for them. And so right now, LifeMD is more in that primary care obesity medicine space. So we're doing a lot of work within that, which is a super interesting field. And, obesity and asthma, for example, really go hand in hand. And so if you're obese, you have a higher likelihood of becoming asthmatic or your asthma worsening. And so, I'm really interested just in the ways that all different medical conditions can kind of intertwine. So yeah, so it's been a whirlwind. Like the last 3-4 years have just been really mind blowing. And I've learned so much. I can say just from building Cleared, I feel like I had, got mini MBA, a mini
Yeah.
degree in like social media and marketing and just even communications, like how do you communicate to patients on a large scale? How do you create what they call a CRM, customer relations management tools, and all of these things that, I never even imagined learning about in med school. And so it was a great opportunity. And I'm just so thankful really to Jimmy and Ryan for giving me that opportunity and for everything that we were able to do.
Absolutely. Are you, with the obesity medicine side of things, are you still involved in the telemedicine portion of that? Or kind of like to your point earlier, when in 2022, when that was telemedicine wasn't as relevant because the pandemic had kind of tapered off. Is that still something that's very active with lifemd.com? Is the telemedicine portion as a whole, and they've just narrowed that focus of the telemedicine to obesity? Or
Yeah.
is that still an active, tool that's being used?
Oh, absolutely. So
Okay.
telemedicine is not going anywhere. I
Okay.
think what ended up happening is that the pandemic really like jump started it, right? People were
Hmm.
thinking about it. They were like, this seems like a good way to see patients, to help more people, to be able to kind of streamline it. And it really is, So we are doing thousands of consults. I don't know if it's thousands a day, but it's hundreds a day, thousands and thousands a month. And, what I love about it is that it really is amazing specifically for patients that have a really difficult, they're moms, they're working 2 jobs, they just don't have time really for healthcare. And I think that can stand true for many, many different types of people, especially in America where we're all just working, working, working. And so your health kind of comes last. And this is a great way to be able to see a patient in their car, on their way to pick up their kid, in their home, in their bed. I mean, I see so many patients that are like cuddled up in their bed, ready to go to sleep, but they're doing this consult before they go to sleep and wake up the next
Yep.
day to do their 3 jobs, And so I just think that it's amazing. And then for me as a provider, I love it too, because I'm really able to drop my son off at school, pick him up from school. Sometimes I'm doing consults like when I'm on the move, and people understand because they're also on the move. And so it's really cool. I think it really is changing medicine, and we're able to really help people that otherwise wouldn't be able to be seen. And even people that aren't insured, these direct to consumer models. So that's what LifeMD is. It's a direct to consumer. So
Yep.
consumers can opt in, get care. Right now, we're not doing insurance based, but in the future, we may be. And, so there's so many different versions of telemedicine platforms. And I think it's definitely not going anywhere. And it was just jump started by the pandemic.
Absolutely. Ton of benefits to telemedicine, I think. I mean, the ease of access for the consumer, the being able to talk one-on-one at 9 o'clock at night when they're getting ready to go to bed. Like, I like that idea. I like the fact that you can have a video conference like you and I are doing, or it can be, submitted, what do you call it? Asynchronous, where it's not, face to face. I get a lot of the benefits. What are some of the risks though? But as you were talking through that, where someone can submit their information and then a doctor is, what are the risks for the doctor in looking at, okay, this consumer, this patient has submitted all of this information to me, and then I have to either make a recommendation or, a next step based on the information I provided. When I hear that, just as a business owner myself, I feel like, okay, there's a lot of risk on my end of if my recommendation or next step thought process is incorrect and it harms that patient, that's on me. Or is it the same risk that you would have, in traditional medicine that you would have, in a clinic?
Yeah, I think about this often. And to be
Mm-hmm.
honest, whether you're in the office or whether you're over telemedicine, you are relying that person to give you their background, to give you their
Yeah,
history.
whatever they've said to you, like, yeah, it is
Going
what it
on.
is.
Either way, you are relying on that individual.
Mm-hmm.
And the key thing is you need to document, right? You need to
Mm-hmm.
document that this is what this individual is telling me, and this is why I'm making these recommendations that I'm making. And then also the conditions that we're treating over telemedicine, again, it's not for every single condition, right? There are certain conditions that the patient needs to be listened to, either the airways or the heart, or there's procedures that need to be done. There needs to be a biopsy, the rash that they're experiencing. They need to have just different procedures, right? And of course, we can't do that over telemedicine.
Mm-hmm.
But, there are ways to listen to a heart. There are ways to listen to the lungs over telemedicine. There are tools that
Oh,
are coming out, will be available even more readily. Even our phones, I think one day are going to be able to be used to like put next to your heart, or, give the patient instruction, and then the doctor's going to be able to hear their heart. There's just so much technology coming out. And even now, there are in rural areas in America, there are places that you can go where they have an entire setup where there's kind of like a tech that's helping the doctor do all these things. So they have a stethoscope that they can put on the patient's chest, and that stethoscope is linked to a doctor in a totally different location, and that doctor
wow.
can hear everything that's going on. And it's that tech is making sure that the placement is correct, that everything's working correctly. But there are all of these kind of facilities that are available, and the technology is there, and it's just figuring out how to use it in the right way. And especially for rural communities, suburban communities, places where, or urban, I should say, urban communities where there is not as much access to care as you would want for specialists, subspecialists. This is super important, and really smart people are thinking of really cool ways of streamlining the system.
You answered kind of my next question, is how does this work? I think it's really beneficial for people in rural areas. So you already said that. Like, I'm here in Iowa. I live in Des Moines, which is, the largest metro in the center of the state, but I grew up in a very small town, in Western Iowa. And so I just think back to a subspecialty like you have, where it's like if we didn't have an immunologist or somebody who's specialized in a certain allergy, in my hometown, they're driving an hour and a half to get here, to quote unquote the big city, right? And so we get snowstorms. We just got 22 inches a couple weeks ago. It's like, what if there's a snowstorm? It's like, I can't get to a major city to be able to meet with that specialist. Telemedicine is a perfect, solution for that. And so, yeah, I agree. It's not going anywhere. It could be very, very helpful for a lot of places in the United States. And so, yeah, I think that's awesome. And what you guys are doing there, I'm very intrigued by the different technologies that are out there to hear, a stethoscope that's linked to something else can hear a heartbeat, and, a doctor 3 hours away can, make a determination based on that is absolutely incredible.
Yeah, it is. It's incredible. And I'm also involved with another company called Sitka Medical,
Mm-hmm.
and they are doing an Arista MD. They just merged, but I actually worked for each one individually at one point in my life. And so basically, they're doing peer-to-peer consults. And what that means is
Mm-hmm.
that you could have a nurse practitioner or a physician assistant working in one of these rural communities, or even a physician working in one of these rural communities that don't have access to referral system, or the patient would have to drive hours and hours, and they want to know, is a referral even necessary? Can I
Mm-hmm.
manage this patient? Can I do some testing on my own? Is there any blood work that I could do? Are there any medications we could try? So they basically send the history, the question, and then I, as a physician that's working on the platform, can review that history, the question, and can give my recommendation. And it's just a great way to save time for everyone, right? And you're kind of providing education to that provider about a certain condition, so that the next time they see it, they kind of know what they want to do. They know what they're going to do next time in order to treat the patient before they refer. And so it's a really cool system, another innovative way to use what we call asynchronous consults, that
Absolutely.
delivery of information to another provider to get some feedback.
Yeah. So in the scenario you just gave, is there ever a situation where maybe that condition becomes more advanced to where you've given your feedback, through the asynchronous process, but now it's become advanced enough to where, does that patient come to you? Do they make that travel point to come to you, or is it they go to the specialist closest to them? How does that work through that platform?
They would go to the specialist closest to them. So then
Okay,
that
that makes sense.
provider would refer out to whoever they would normally refer to, but it would be more of a streamlined referral, so that the patient isn't taking a day off of work to go for a consult that maybe wasn't necessary. So the lost
Mhm.
time from work, from school, from all of these things can have a huge impact on people, their livelihood, especially if they're dealing with a chronic medical condition. And so we don't always think about that, the quality of life of patients that have multiple conditions. They need to see multiple specialists all the time. Again, it's just streamlining the process and making sure that they're
Yeah,
actually going when they need to.
absolutely. Very cool. Love talking innovations on this podcast, and that is certainly one. I think that is so cool. And I bet if you talk to someone, that was a practicing physician 40 years ago, and you try to describe this process to them, they'd be like, no, that is, that's like going to the moon. That doesn't make sense. But I
Well,
just think
even
that's really
now,
cool.
yeah, sorry to interrupt you. Even now,
No,
there's
you're good.
physicians that are still like, are you on a different planet? Like, what are you doing? You're not practicing real medicine. So even now, there's still a lot of education that's happening among providers and patients. So I think as much as it's advanced, there's still people that aren't completely buying in. But I think like
Hmm.
slowly that's changing, and the education system is changing. I think telemedicine is becoming more a part of medical education too, in residency programs, medical schools. I think now everyone's talking about it and understanding that it's an important tool.
Yeah, for sure. There's a common phrase in the world of business or entrepreneurship that if you're not adapting, you're dying. And I think
Absolutely.
that can be true in what you just said, that
Mhm.
there could be physicians who think you're on another planet doing what you're doing, but it's like that's the direction that medicine and healthcare is going, and you got to be able to adapt to it,
Absolutely.
for sure. I'm going to switch gears on you. I was excited to talk about the telemedicine piece, but I want to talk about your podcast. The Itch is with, I believe, a former patient, correct, Kortney?
So she wasn't a former patient. Actually, I met
Okay.
Courtney because we were both doing advocacy work with the Allergy and Asthma Network. So they are not-for-profit. AAN is a not-for-profit organization that works on advocacy, education, all patient-centered, great work. And every year they have something called a day on Capitol Hill. So all of these people go, patients, physicians, providers, we all go to DC, and AAN puts together this entire platform where we see our, and I always get these terms messed up, but we are the constituents, and we see our representatives and talk to them about different bills that are being passed in regards to different conditions. So there might be, a food allergy bill that's being passed, that all daycare centers should be educated on food allergies and how to properly treat anaphylaxis, for example. And I, as a physician, would tell that representative, hey, this is why this is so important. And I would give them real patient stories. So anyway, Kortney and I decided to do that on our as individual people. And we ended up being in the same group. And Kortney is a patient blogger who suffers from many allergic conditions, including food allergies, eczema, asthma. And so she is really passionate and was, doing a lot of social media, writing, blogging, patient advocacy. And so both of us got put into a group. And then through Instagram, we stayed in touch. And I don't remember if it was her or me, but one of us was like, you know what? There's not a podcast on allergies and allergic conditions. And so we just decided to get it started. And then, we brainstormed, came up with the name The Itch, and, just got it started. And that was back in 2019, which is kind of mind blowing that it's been 5 years. But fast forward, it was really just a passion project. Neither one of us was getting paid. It was just, something that we did out of the love, like providing education and kind of thinking outside the box on how we could teach people about allergic conditions. And it's kind of like a balancing act. That's our whole thing. Is I am the physician, she's the patient, and we kind of balance each other out. And she asks the questions, kind of like what we're doing today. But, she asks the questions that she has about a medical condition, and we do like deep dive episodes, we do interviews, and we shed light on lots of different conditions. And so yeah, it's been great. And now we work with the AAN, with the Allergy and Asthma Network pretty closely, because they're, again, an advocacy organization, educational organization, and they think of different ways on how to educate patients and physicians. And so now we're working with them a lot to produce a lot of the podcasts that they kind of come up with. We're doing a whole series on mast cell disease right now. We did a series on eczema in patients with skin of color, and the differences that and the things that people have to consider if they have darker skin with asthma. So it's just really fun. I love working with Kortney. She's awesome. She's super articulate. She has made me a better speaker, but it's just really, really fun to put it all together. And it's just another kind of representation of how a passion project can turn into a side hustle, for lack of a better word, because now, we are working with educational grants, and we're able to, use those educational grants to support our time in doing it. Because, as putting on a podcast is a lot of work. There's a lot of
Takes
editing.
a lot of time.
Yeah, it takes a lot of time. The promotion of it, all of it takes so much time. And so, so it's just been really fun and nice. And we're able to do more and more of it now that we're working with the AAN.
Yeah, that's awesome. I love when, obviously, this podcast is very unique, and it's very niche in that, between, a financial professional and a doctor, that's just not something that's out there. So to have a podcast specifically for allergies, I think is a brilliant idea. You guys are over 60 episodes in, I believe I saw yesterday. I was doing a little research on you before our conversation today. The kudos and the compliment that I want to give to you and to Kortney is the website that your guys' podcast sits on. The website, typically it's, hey, here's, and I even looked at our own website. I'm like, man, we need to up our game a little bit. But because usually, you go to a podcast website and it's like, here's the episodes, here's the name, here's a brief summary of the conversation. Your guys has so much educational thing, and now it makes sense if you're getting the education grants, and you're really trying to provide more education to not only the listeners but anybody who goes to the page, because not as only is there just the recording, but there's a huge library of information on topics of all over allergies. There's tips and tricks, so much. I can't imagine, like, is that something that you and Kortney spend a lot of time working on, is the website and building it so that it is an educational tool, not just a place to hold all your podcast recordings?
Yeah, so I would have to say all credit goes to Courtney. We kind of,
Okay.
envisioned this website and we put it together, but she's the one that keeps it up. And we have had interns, like lots of great people who have wanted to learn about what we're doing. They're either in med school or in residency or in fellowship, and they're just interested in learning more, being a part of everything. And so we've also
Hmm.
had people that have been in the mix to write some of those blog posts that you're talking about and help us in that effort, providing more education around the episodes.
Yeah.
So yeah, no, definitely it's, we try to make it as robust as possible. And, even just putting out the show notes, right? So being able to
Yeah.
transcribe it and then putting that out as kind of a blog or whatever, so that everyone learns in different ways, right? And
Hmm.
that's what all of these tools are, and that's why I like the diversity in the way that we're able to provide education. So from podcasting to reading about conditions to Instagram, TikTok, I mean, people are consuming information in so many different ways, and that's so important, right? So the
Hmm.
more informed that we are, especially about our health, the better it is. And so I just think that it's really cool that we're becoming more and more open to all of this stuff. And I think there's more and more doctors that are putting out content on all of these different types of platforms. And so we try to do a mix match of a lot of things. We have an Instagram, we don't have a TikTok yet, but we're on LinkedIn, we're on Facebook. So just trying to make the information accessible, and that's really
Hmm.
our goal, is to be in as many places as possible, so that the effort that we're spending on creating this information is disseminated to more and more people.
Absolutely. And I agree with you when you said it is really cool that you guys are doing that. Not just the different social media sites, the Facebooks, the Instagrams, but I think the different media, the different types of media that you're putting out there. You have the audio version, right? There are people who like to learn, and so they'll jump on and listen to you and Kortney talk about it. But there's other people who are very visual, and so they're like, instead of listening, I would rather just read. And so I think you guys do a great job of providing a summary, giving those show notes. Here's some tips and tricks. If you have, this or that, here's how you can and take care of it. And I just think the different media types that you put out there with all of that educational information is it's different. It's not common for a lot of podcasts, and that's what I think makes it pretty unique.
Thank you.
You
Thank you.
bet. So I have to ask this one just because it's all that seems to surround my house with my wife planning a bunch of baby showers. So last April, you and Kortney had an episode titled "Early Introduction of Allergens in Babies."
Mhm.
So both of my sister-in-laws are pregnant right now with their first kid.
Mhm.
One's due in March, one's due in April. My wife is planning both of their baby showers for her younger sisters. Food allergens has been a topic that they've been asking my wife about. We have 3 kids already. So previously, it was believed that delaying the introduction of allergenic foods, peanuts, eggs, all the things, could help prevent food allergies. However, now there's a bunch of studies coming out, saying that early introduction as early as 4 to 6 months as they're starting to eat more solid foods can help prevent allergies, in foods then. So why do you think there's been this change in the early introduction of allergen foods in the last decade?
Yeah, I mean, there's been some pivotal studies, one in particular, the LEAP study, and I
Okay.
always forget exactly what it stands for, but it's basically what the study did was they looked at one of the researchers found that, kids in certain areas were exposed to peanuts early and they didn't really seem to have any peanut allergies. And so they did an evaluation. They fed, they kind of had 2 different groups, and they fed the certain kids early on this product called Bamba. It's a peanut like puff early
Hmm.
on, and then there was another group that didn't get that Bamba, and they found that that group that didn't get Bamba had a higher rate of allergies than the group that did get Bamba. So that was one of those studies that showed that, and then there's been several others that have kind of just basically said the exact same thing for different allergens. And so we know now definitely for sure that early introduction is very important. And it doesn't mean that you're putting it, basically you're feeding the child when the child is ready to be fed. So that's usually around 4 to 6 months. There are certain products that you can put in the bottle and feed it that way. But, I would say around 4 to 6 months, when your child is ready to take in solids, that's really when you should start introducing different allergens. So things like peanuts, tree nuts, egg, soy, all these things should be introduced as early as possible. Just having a diverse diet early on allows the immune system to understand that these foods are good foods, that we should be eating them, and it just doesn't allow that allergy to develop.
Gotcha. That was a great answer. Nice.
Okay.
Um, you're like, I'm not sure if it was. No, yeah, it definitely was.
But also I
Uh,
just want to say early and sustained introduction.
Good
So
thought.
it's not just a one and done. So it's not like, okay, I fed my infant, peanuts once and now they're not allergic. It needs to be sustained. So we do need to have, like a daily dose or every other day dose, those allergens. And, there's lots of different ways to do that. There's lots of different products out there that kind of mix different nuts together. Obviously, you need to try each individual nut on its own, and then you would continue to expose that nut. So you can't go to those mixtures right off the bat. You have to introduce each nut individually, and then you would be able to do some of those mixtures. But there's a lot of easy ways, and that's the key. I'm relatively new mother, and I know how hard those early years are, those early months are. And so this is just another thing that we have to think about as parents, but it doesn't need to feel so stressful. I think there's a lot of easy ways to do it, and a lot of people that have a lot of experience in giving those tips. And we've interviewed a lot of those moms that that have made it easier on themselves, and have found different shortcuts on making that whole process easy.
Absolutely. Is you said do it starting with each different nut, not the blends of those. Is it a matter of introducing the nut directly, or is it, hey, you're going to have some peanut butter and we'll figure out if you're allergic to peanut, or is it, we have another food that we think you'll like from a taste perspective, it happens to have one of the ingredients is peanut, and that will suffice? Or does it need to be like a straight on introduction to it?
Yeah. So, with infants, what I would say, or with early introduction, is the key principle is doing, first of all, like, products with a bunch of stuff in it. I don't recommend for anyone really, for adults
Hmm.
either, but
Yeah, for
like
sure.
really processed foods. So really just the whole food, right? Number
Hmm.
one, just for health reasons. Number two, we want to make sure that we're not confusing the picture. So if you were to, for example, give like a tree nut mixture, like a bunch of like pecans, almonds, cashews, all mixed in together in like a powder form, and you just gave that to your infant off the bat, if they were to react to that, we wouldn't know which tree nut they
Which.
were actually reacting to, right? So it's more
Hmm.
of a logistical issue, is just being methodical in the way that you're doing it, so that if your child does develop a reaction, it's not confusing as to what that reaction was to. And
That makes sense.
so any new food should really be tried one at a time with some time in
Directly.
between. You don't want to do like walnuts in the morning and then 30 minutes later introduce the cashew, and
Mhm.
30 minutes later, you just want to kind of do one day, one food, next day, another food, and then kind of go from there.
Yeah, because in a nut allergy like that, are the symptoms, if there is an allergy to it, is that pretty immediate, within an hour or two?
Yeah. So actually, with IgE, which is the antibody that causes allergic reactions, the reaction should happen within the first 30 minutes of consuming the
Mm,
food, and that's the most common, is within that first 30 minutes. If it's a super delayed reaction, it usually isn't an allergy, and it can be a whole host of other things. So a food allergy will usually present itself within the first 30 minutes, and the symptoms
mhm.
can range. Usually in that infant first introduction reaction, they'll usually be limited to the skin, sometimes vomiting, usually not the airway being involved. And so I don't want parents to be scared. I don't want them to be worried, but I get it. I'm a fairly new parent and we worry about everything. And so, but, realistically, most infants that are introduced to a food that they're allergic to, they're not ending up in the ICU or anything like that. It's usually just
Mhm.
hives, vomiting, and then the reaction resolves. So most even anaphylactic reactions like can resolve on their own. But we definitely want to treat early if we do feel that the person is having an allergic reaction. But I just want to say that I don't want people to be scared to introduce those foods, and a lot of people are. And so what I do with that is, if you are nervous, you can always talk to your doctor. We can do something called, as an allergist, I do these all the time, an oral challenge, which means that the patient comes in, that the parent brings their child in, and we feed that food together in a
Mhm.
more controlled setting. I don't recommend that for everyone, absolutely not, because then there
Mhm.
wouldn't be allergists to see conditions that, for patients that actually need it, if we had a whole line of people that just wanted to introduce their child to foods. But in those children that are showing signs of allergy, and the patients or the parents have already suffered through an allergic reaction that was very scary, and they're just feeling anxious about trying the next food, I definitely offer that to those parents.
Yeah, that's fantastic insight. I mean, that was going to be one of my questions was because we've been asked that before. My middle daughter has a gluten allergy, and so when we were going through that and talking with friends and things like that, as they were becoming new parents, they're like, "Do I need to have like an EpiPen like ready to go when I start introducing these new foods to my kid, just in case?" But I think you provided great clarity there on that's not the case. That's you're not going to have the airway restriction right out the gate with a 4 month old the first time you give them peanut butter. Like it's just it just won't happen. And so I think that's valuable insight that you just provided, so I appreciate that. Last thing I wanted to talk to you about, and it's a big passion of yours. You had said offline it was something that you don't get to talk about enough, but in the bio at the beginning of the episode I mentioned that you are a global health advocate. So you've worked around the world. I mean, Haiti, Liberia, Nepal, India, Peru. I mean, the list goes on. Where does that passion for global health stem from? Is it part A of the question? So where does that passion come from? And then why do you feel it's so important for doctors in any specialty or every specialty to take part in that initiative as well?
Yeah, so I would say that I would attribute that passion to my dad. He is
Mm-hmm.
also a physician, and he grew up in India, and we, went back to India. We're technically immigrants, right? I was born in
Mm-hmm.
Africa, but uh, we would go back to India almost every year. And he is just constantly just dedicating himself to helping other people. And I grew up watching that. And I also grew up going to a country where there is a lot of poverty. There's a lot of people that don't have the health care that we would ideally want them to have. And
Mm-hmm.
so just having that exposure, I think, really made me want to be in that space at some point. So throughout my education, during even undergrad, I was able to go to Ecuador on like just to learn about their healthcare system, and to watch doctors do work out there, which was really cool. But then through medical school, I was able to go to Malawi and learn from a lot of some amazing people. Dr. Terry Taylor, she does a trip every year with students at Michigan State Medical School, where she brings students in and helps them see healthcare in Malawi, which is in Africa.
Yeah.
And she does a lot of work in malaria for years and years and years. So she's been doing that that's like a part of her life, right? And then I actually after my fellowship. So I went straight from undergrad to med school to residency to fellowship, and I never took any breaks. I did these mini trips, but I was never in a country for like an extended period of time. And I was
Mm-hmm.
always wondering and curious, like, is that something that I would want to do and thrive in? And so I did something that everyone was kind of like, what are you doing? Like, this is finally the time that you're done with your education. You can finally make money, and now what are you doing? And yeah, I did it, and it was the best decision of my life. I left the country and I took what I now call a sabbatical. I
Yeah.
volunteered with several different organizations. I found one, cross-cultural care in Liberia, run by this Dr. Robert Montana, who is an ER physician. And he basically fell in love with Liberia, fell in love with this small town called Robertsport, and he started to help doctors go out there to provide care. So I was literally in the middle of nowhere in Liberia and helping kind of provide medical care, but also look at the healthcare setting, look at the hospital and see how we could improve the systems that were in place there, educate the nurses, educate the providers, and really education is key whenever you're doing any of these projects. And then I was able to go to Nepal, and in Nepal, I had the most amazing opportunity. I was able to meet Dr. Paul Farmer, and I don't want to start crying, but every time I think about him, it makes me want to cry because he died suddenly a couple of years ago. And that was just a big loss to the medical community, to the global community, because Dr. Paul Farmer, who then became my friend, started an organization called Partners in Health. And Partners in
Okay.
Health is basically what the name implies. It's like a Doctors Without Borders, but Doctors Without Borders is more for emergency care, and Partners in Health is really trying to become partners with the local healthcare system in order to uplift that healthcare system and make it even better and stronger. And so he started his work in Haiti, expanded into Africa, Navajo Nation, South America, and has like basically started this organization in med school. I mean, it's just like
Mm.
mind blowing how much passion he had and how smart he was. And just, he's written books and books and books and books on the topic. And I think, it was just an amazing experience. I got to meet him because the organization that I was working with in Nepal brought him over because he was kind of christening it, like essentially like
Sure.
giving his blessing onto the organization and saying that they were doing good work. Now it was called Nyaya Health. Now it's called Possible. Basically, Dr. Maru, the doctor that started that, Duncan Maru, he was basically a mini Paul Farmer, I like to call him, and
Mm.
he
Yeah.
started this, the same kind of vision in Nepal that Dr. Farmer, that Paul started in Haiti. And so, anyway, I am long-winded in this answer, but I just, it's just amazing to see all the different types of systems out there. And now, with everything going on in the world and with the way that we're able to see the suffering of other people so head on, it's just, I think everyone should be aware of our privilege, because I think about that every day. I talk to my son about it all the time, about how lucky we are. I think we tend to look at what we don't have, and really we should look at what we have on a daily basis.
Mm.
And I think it's hard. It's hard for us as humans to do that. But it's just so important. And I think having that perspective, I think a lot of people in the US especially don't travel, aren't able to go out of the country. Not that they don't want to, but they just are not able to go out of the country and see
Mm.
the way that the rest of the world functions, or different parts of the world function, I should say. And we are just so privileged and lucky. And so I just, I wish I could do more of that work. I did realize, though, from doing the work that I did, that I am very much an empath. I kind of
Yeah.
take other people's pain on head first, and that work was super gratifying, but it was also like really hard, at
Yeah.
times.
Draining, probably. Yeah.
Yeah, it was draining, and some people don't get drained from it. Some people aren't as affected by that, and that's amazing, because then they're able to do more in those settings. Like Paul Farmer, he would cry about patients, but at the same time he would keep going. And when you go into these different settings, you realize, oh my God, I'm never going to make a difference. That's the thing that you start thinking. And
Mm.
he went that next level. He's like, you know what, I am going to make a difference. And he did. I mean, he did. He started one of the first cancer hospitals he helped start one of the first cancer hospitals in Africa. So it's just that vision and that kind of perseverance of knowing that you can make a difference that I think you need if you want to go into a career in global health. And I hope that for the second half of my life, because that's where I'm at now, is I'm kind of in
Hmm.
that second half of my life. I hope that in that second half of my life, I'm able to use all of this knowledge, all of these tools that I have to really create something where we're helping people on a different level. I think as doctors, we're always helping people, but I think there's different levels of that, right? So I have helped
Absolutely.
people, but the way that Dr. Paul Farmer helped people, mind blowing,
Yeah.
just mind blowing. So I just,
Mhm.
yeah, I just think about all of these stories, all of these people that really are making these huge impacts. And there's so many people out there like that. But I hope that in
Absolutely.
the second half of my life, I'm able to do something more meaningful and powerful like that.
Yeah. Well, thank you for sharing that. You had said that you don't get to talk about that enough. So that was great for you to share that. First, I want to say sorry for the loss of your friend, Dr. Paul Farmer. It sounds like he had such a tremendous impact on you, but also for hundreds, thousands of people, around the world. So that's very cool. And I'm definitely going to look him up after the show because I want to learn more about that. My thought then goes to another question is, as you've had all these experience in these different countries and you've seen these different organizations, what do you think is the biggest thing that's missing in other healthcare systems around the world? Is it the education? Is it technology? Is it access to subspecialists like yourself? That there's just not that access to those. There's the primary care physicians, or there's the emergency medicine doctors that are going around the world. But what do you think the biggest thing is that's missing in other healthcare systems around the world?
It's a combination of all of that, to be honest
All
with
of that,
you.
I figured.
There
Yep.
are so many things that go into having a robust healthcare system, and you just we just take it for granted. We have a
Mhm.
lot of things that have been in place in the US for a long time. And I think, and other, countries like Europe and things like that. But it's just, yeah, it's a mixture of, money, technology, just resources, people that are an education, like a strong educational foundation. And again, organizations like Partners in Health really go in and try to help with medical education. They get into the medical schools and kind of just take it to the next level, and then get into the hospitals and provide technology and resources that can then help those doctors succeed and provide like uh, better medical care to all of their patients. So it's
Mhm.
just a combination. And sometimes it's just, also having more people that you need to treat than you're able to treat. So it's just, even just the overwhelming number of people that need help in any given
Mhm.
area too can overwhelm the healthcare system. So it's just a combination of so many different factors, and it's so variable. But I think in general, resources are always, number one. Resources, education, those are the two
Mhm.
things that ed- that can make a huge difference.
Yeah, this may be a very broad economic question, but how do we solve some of those things? Is it donations from the common person to these organizations? Is it local governments need to step in? Is it providing education on how to fundraise? Teaching these healthcare systems around the world how to fundraise and bring in the capital to be able to provide the resources. What do you think the you can be broad with your answer as well, because my question's kind of broad, but what do you think is the main solution for that?
So I am definitely not the best person to answer that. I'm not an
That's okay.
expert on this at all, but from the learnings from, what Dr. Paul Farmer and all the messages that he brought to the world, I think it is a government issue. It's
Mhm.
the resources on a governmental level, but it's also just people caring,
Mhm.
and I think that at the end of the day, if we all cared enough about other people, other humans, their suffering, that together we can make a big dent in the way that the world operates. And I
Yep.
think that that is really, for me, the big message over the last 6 months, even like with everything that's going on. It's just, I don't know about human nature, and sometimes it's just, we just need to care. We need to care about other people's suffering. And I think that is what I saw the most in people like Paul Farmer, is that they just
Mhm.
had this intense need to care for other people's suffering and to help other people.
Yeah, I think that compassion comes first with awareness. I've said it on other episodes, like the way that things go from point A to point B is first there has to be awareness, then there has to be an understanding, and then there has to be action. And I think just getting to the awareness point of hey, there is this problem going on, understand what is going on and how to fix it, and then actually taking action to fix it, I think is the biggest thing. So the more awareness we can get out there, not just in the physician community, but in the patient community, that these things are happening, and people to realize how good we do have it in the United States compared to other countries around the world. Yeah, I would jump on that train for sure. Final question for you. Might be the easiest one, I hope. What's next for Dr. Gupta in 2024 and beyond?
Oh, you think that's the easiest question?
It's the shortest.
I would say for me, like I said, I just, I want to take this next half of my life and really make meaningful impact and difference. I don't know how that's going to happen, but that's really what my goal is. I want to impact the world in a more meaningful way and on a bigger scale if I'm able to.
Absolutely. Great answer. Well, Dr. Gupta, I am appreciative. I'm grateful that you took time out of your day to join me and to have these discussions and answer my long-winded questions. But I look forward to our paths crossing at some point in the future.
Yes, thank you so much, Nate, for having me and for asking all of these thoughtful questions.
Absolutely. Thank you.